If you're a woman over 40 and you're trying to conceive, then you're in the right place. Today, I'm sharing 20 essential fertility tips that are backed by research and also holistic health practices that will help you support your fertility journey. First, let's look at the statistics for women without a health diagnosis like endometriosis or PCOS or an autoimmune disorder. The chance of conceiving naturally each month for a woman in her late 20s and early 30s is about 25 to 30%. By age 35, this monthly conception rate decreases to be about 15 to 20%. And after 40 years old, it further declines to around 5 to 10% per cycle. Again, that is women who are not dealing with a health condition that is causing infertility. As we age, our fertility naturally declines, but that doesn't mean it's impossible to conceive. Women over 40 who are trying to conceive often face challenges. Let's go through a list. Perimenopause symptoms, irregular periods in their 40s, irregular ovulation tracking, poor ovarian reserve, PCOS or polycystic ovarian syndrome, especially over 40, fibroids and fertility challenges, ovarian cysts and conception rates are tricky, endometriosis. While they're trying to conceive, sometimes the endometriosis will cause infertility. And then we have to talk about age-related fertility decline and what that means. It can be decreased egg quality, hormonal imbalance fertility issues, high FSH levels, low AMH levels over 40, thyroid disorders and conception challenges, luteal phase defects, recurrent miscarriage, secondary infertility, which often women face once they're in their 40s, multiple IVF attempts for women, especially after 40 years old, or experiencing canceled IVF cycles. Egg donors are often recommended by IVF doctors, even for women just over 35. Uterine health we have to look at when we're talking about infertility, gut biome issues, inflammation, sleep issues, high stress. That sounds like a lot to handle on your own. Just worrying about these possibilities can cause infertility and fertility challenges. With the right approach and the right guide providing you with a clear path on your fertility journey, you can boost your chances to get pregnant and have a healthy baby. In a bit, I will mention a little bit more about how to have a free consultation with me so we can dig into that information. But first, let's start with nutrition. Research shows that eating a balanced diet rich in specific fertility nutrients and fertility foods can improve fertility health by up to 67%. Number one, omega-3 fatty acids. These can be found in salmon, chia seeds, and walnuts. They support hormonal balance and egg quality. Our next tip, number two, leafy greens like kale, spinach, broccoli, all these are packed with folate and antioxidant. Number three, include fertility superfoods like eggs, bone broth, and figs, and that will also help to support egg quality and egg health. Now, let's talk about lifestyle changes that can make a huge difference for women who are trying to get pregnant, especially over 40. Number four would be regular exercise, such as walking or yoga improves circulation and reduces stress. Number five, aim for at least 8 hours of quality sleep per night at regular times to support hormonal regulation. For example, every night go to sleep within the same half-hour frame, 9 to 9:30 or 10 to 10:30. I would not go to sleep later than that, and it really depends upon your lifestyle and your work. We can talk about that. Number six, drink plenty of water. Drink half of your body weight in ounces to keep your body functioning optimally across all systems. What I mean by that is, for example, if you weigh 150 pounds, you would aim to drink 75 ounces of water, and it's dependent upon physical activity as well. Next, stress can significantly impact fertility, so finding ways for you to manage it is crucial. We get to our seventh tip. Practice daily meditation and mindfulness to reduce cortisol levels. Research shows just meditating for 5 to 10 minutes a day has a significant impact on overall health. Number 8, Simple deep breathing techniques can calm your nervous system. Even just doing a few minutes a day or here and there throughout the day is very helpful. Number 9, spend time with loved ones who make you laugh and feel supported. Avoid the Debbie Downers. By the way, if you don't know me, I'm Dr. Gina Terinoni. I'm a board-certified doctor of acupuncture and Chinese medicine. I'm also a certified women's healthcare practitioner in integrative medicine. I use 2,000-plus-year-old medical practices combined with the latest scientific research. In the past 23-plus years, I've helped over 2,000 women and couples to become pregnant and have healthy babies. Subscribe to my channel now, please, and comment egg 123 to get my egg quality optimization checklist. In addition to lifestyle changes, consider integrating both conventional and holistic treatments. Tip number 10, acupuncture can improve blood flow to the ovaries and balance hormones. It's also really helpful to get rid of or reduce inflammation. Number 11, herbal supplements like Vitex and maca root may support reproductive health, but personalized herbal formulas are way more effective. So I highly recommend, if that's something you're interested in, book a free consultation with me, and you can comment below if that's something you want to learn more about. Number 12, get labs done, but only the ones that you actually need, and get them done at a minimum of every 3 months. This is really important to establish a baseline so you can strengthen your foundational health and add in very specific and personalized herbal medicine and supplements. It really does help you save money, time, frustration. I always say, stop throwing spaghetti at the wall. This will overwhelm your system and most likely blow out your gut biome. Only take what you need. That is critical. Self-care is vital for mental and physical well-being. We all hear that, but are we doing it? So tip number 13 is reflect on your fertility journey. Use a journal and set positive intentions each day. Just take a couple minutes in the morning. And also, if you're into it and you've got some time, write down meals that you ate that day, how you felt an hour or two after you ate. How are you sleeping? What is your energy level like throughout the day? Is it better in the morning? Is it worse in the morning, better in the afternoon? All of these things give great information. Tip number 14, reduce exposure to environmental toxins by choosing organic products as much as you can and avoiding hormonal disruptors found in foods, bathroom products, makeups, body lotions, sunscreen, cleaning agents, and clothing. There's so much more, furniture as well, and paint. Number 15, focus on what you're thankful for to boost your mood and resilience. This can be worked into your daily routine and into your journal. I highly recommend doing this. I think we take some things for granted sometimes, but when we really think about all the good things that are happening around us and getting away from too much news or hot topics in that way, that you'll feel a nice boost. And for those needing advanced support, here are some additional tips. Number 16, use apps or devices to monitor ovulation, but know that sometimes they aren't 100% accurate. It can be a guesstimate. I help women to naturally track ovulation and their cycles, and I can talk to you more about that in a consultation. So comment below consult, and I'll send you a link to my direct calendar, and hopefully we can get on a call in the next week or so. Number 17, if you're going through or considering IVF or FET or IUI, it's really important to look outside of the procedures and medications and take control of optimizing your fertility health. If you're doing something like IVF, for example, it's not all in, I'm just doing that. There's so many other things that you can do to improve the outcomes and improve the success of getting pregnant. And not only getting pregnant, but having a healthy baby. Number 18, work with a holistic doctor and coach like myself to ensure that your hormones are at optimal levels and you are addressing the root cause of your infertility or getting pregnant challenges, and not just treating the symptoms or aggressively medicating your body without root support. If we band-aid or we just are constantly treating the external things, nothing's changing below. That's so important to address that, and your entire life gets impacted and improved that way. Number 19, be open to new ideas and other ways to improve your fertility health. Remember, Western doctors study Western medicine, and they're excellent at it. They are not educated on how to enhance and optimize the body with natural and holistic approaches. These approaches have effectively been used for thousands of years. So if you're working with a Western doctor, endocrinologist, fertility specialist, especially with IVF or something, you also need to look at working in a holistic doctor like myself. We can work together and give you the best of all the medicines. And number 20, consider joining a fertility community. This is a great place to share experiences when you're tired of trying to explain things to your friend or your family or your partner or your husband. It's really nice to have other women that are in a similar situation to you. Comment consult below, and I want to learn more about your fertility journey and also see if there's any red flags that I see or areas that would be good to focus on right away. I hope these tips are helpful. I hope you feel more clear and more empowered on your fertility journey. Please subscribe to this channel. Drop a line if you want extra help or if you'd like me to focus on a specific topic for one of my upcoming videos. In my next video, I will dive deeper into the fertility diet, how to eat for conception, and we're going to walk you through one of my meal plans that I made for a recent client.